Hi, this is Douglas Schofield responding to week 8 and creating a short video for pain teaching. Uh, so the patient is Becca Hart. Apparently she just had a baby while here in the hospital and is expected to be discharged today. And from what I understand from the video, she's going to be discharged on Motrin instead of the Percocet that she's requesting. So in teaching with Becca Hart, I will meet with her, first introduce myself, and discuss to her in regards to the reasons that they will not be ordering the Percocet. So I'm going to talk to the video like I'm talking to her. Good evening, Becca. My name is Douglas Schofield, one of the nurses here. And I understand that you have some questions in regards to your pain your medications that you're taking currently for pain. One of the things that I was informed and reported that the doctor ordered Motrin for you instead of the Percocet that you requested. And so, and there's some concerns in regards to ordering a Percocet, especially if you're going to be breastfeeding your child. One of the biggest concerns is that the pain medicine can be passed on to your child through your breastfeeding, and so we don't want to put you nor your child in harm's way at all. And so the physician is going to order you Motrin. If the Motrin upsets your stomach, then one thing that I would encourage you to do is not to take the medication on an empty stomach. And then we can also bring the doctor back in and talk to you as well, and to see if there's any alternatives in regards to the Motrin, maybe Tylenol or something different. But it'll be up to the physicians to decide. But while I have you here, I want to talk about the impacts of the pain. One of the things that I really wanted to really express is that, dealing with chronic pain can affect your mood. It also can make you very frustrated if the pain is not being relieved. It can make you depressed. And so it's important that you discuss with your doctor. You start having feelings of frustration that nothing is helping you in regards to pain management or managing your pain, that you have that further discussion with your physician. But one thing I wanted to talk to you is there are other alternatives to pain management, and I don't know if you tried any of those alternatives and have they been helpful. So it'd be good for us to discuss that. But prior to that, I just want to give you some other alternatives. You can always apply heat to the area of the pain, and usually when you're applying heat or via some warm compress, you can I suggest for you to apply it to that area for 20 to 30 minutes. At least every couple of hours, unless the doctor directs you otherwise. Another thing you can try is massage therapy. Massage therapy is very good, especially if your muscles are tight, which helps to increase the pain. Massage therapy helps to relax those muscles, and so it helps to release and reduce the pain as well. Another alternative that you can try is, we call this a TENS unit. It's an external unit that is placed to your skin or the area of the pain, and it basically helps to help relieve the pain by giving it some sort of electrical impulses or pulses going through the muscle and so forth. And it's a very good external way to help control pain. Another thing that you can also try is ice. One thing about ice is we want to make sure that you don't keep the ice on that particular area for any very long period of time, because it can injure the skin. But ice can help to reduce swelling. It can also help again with reducing pain. And what we encourage you to do is apply it 15 to 20 minutes. So if you have an ice pack, what I would do, or anything that you can place crushed ice in and create your own ice pack, is place it in a bag, crush ice, cover it with a towel, and don't place the bag right directly to your skin. You want to make sure you have a barrier. So use a towel to cover that and place it on the area, and you can keep that on there for at least 15 to 20 minutes and apply it every hour, or as directed by the doctor. Another thing that helps to reduce pain, it helps you to relax, is music. You can also try aromatherapy. All those are very great alternatives to help to reducing the pain. So I would encourage you to try to use one of those and see which one is effective, at least until the 2 weeks until you follow up with your physician, and let your physician determine whether he wants to continue to order any further pain medication for you. But one of the things that another safety concern in regards to taking any pain medicine, especially those that might have any type of codeine or opiate, is that it will also impact your your alertness, your cognition, and we want to make sure that while you have your little baby that you are being very astute to caring for the baby, and that you're being cognizant of making sure that it's not interfering with any of your ability to function to care for your child. And so and that's very important when it comes to taking care of yourself, taking care of your baby, and also trying to manage your pain as well. And so it's not that we would not want to order any pain medication. It's just right now we want you to make sure that you're very cognizant of taking care of yourself and your child, which is very important. So do you have any questions in regards to any of the pain teaching that I provided to you? Can you repeat back to me some of the alternatives that I suggested to you in regards to managing your pain? Okay, well, thank you. That concludes my pain teaching video. How long did it help? Did you get it?